Good afternoon, Lauren. How are you?
I'm doing well. How about yourself?
I'm good, and I'm really happy to have you here. And I know you already because you were actually my student and you were taking yoga with me, and now you have
I have two little boys now. Yep.
How old are they?
I have almost a 3-year-old and a 15-month-old. So two very close together.
You're busy like me. I had a 16-month-old when I had my second one, and then my second one was 19 months old when I had my third one.
Wow.
Yeah, so, and I know that you are a physical therapist, right? Specializing in women's health.
Yes, that is correct.
Beautiful. And that's something that I feel is extremely important because I don't think many people in the United States realize that in other countries, this kind of service, what you do is offered as I think within the basket or whatever you want to call it, as like almost mandatory for all women to at least see a physical therapist. I think in French, I have a French friend. She said 10 visits is what you get immediately postpartum, right?
That's
and then if you
amazing.
still have, I know, right? If you still have issues or pain or discomfort, then you can apply for 10 more.
Wow.
So I do know for sure from sources of mine that this is something that women get on a regular basis, and the awareness of how important a physical therapist is prenatally and postpartum is high, but it's not like that here, right? So insurances don't encourage us to get a physical therapist.
Yeah, I mean, usually most insurances do cover it, but it's just something that's not, we don't think of it as I'm pregnant or just had a baby and this is part of the routine care where you normally know, you have a visit every month with your OBGYN or your midwife. That's expected every month, and towards the end of your pregnancy, you're going every 2 weeks, every week. And then when you're done, you have that one visit at 6 weeks. And most people never see the OB again until the next problem arises or the next baby or whatnot. So, but never really do OBs actually talk about physical therapy and how it's an important part of your pregnancy and your recovery from pregnancy. So it's just something that our medical community isn't talking a lot about when it comes to pregnancy and postpartum, unfortunately.
Right. So, I mean, in a normal pregnancy, right, a woman might feel some aches and pains, right? I know because I felt it. But when is it the right time to see a physical therapist, and what kind of pain might I feel during pregnancy or postpartum? So where am I feeling the pain, and when should I look for you or another physical therapist in my area?
Right. Well, generally, any pain, whether you're pregnant or not, is generally not normal. We don't want to have persistent pain that lasts, right? And if we ignore that, that pain can become chronic. So during pregnancy, common pain, pain that we see often is in the pelvic girdle area, the lumbar spine, the sacrum, the SI joint, the buttocks. That radiating sciatic type of pain is probably the number one reason that women come to me during pregnancy. And studies actually show that up to 70% of women actually report having pain during pregnancy, reported pain. So probably even a higher number actually have it. And pregnant women tend to get pain because of all the hormonal changes that are going on in your body actually change how the laxity or the thinness and movability, pliability of your ligaments in your joints. So as things get a little bit too mobile, they can start shifting and moving around, and that sometimes can lead to pain. And then if you ever had any sort of pre-existing issues or any sort of dysfunctions prior to the pregnancy, those only get exacerbated by all these hormonal changes, changes in our posture. As our belly grows, it shifts, our weight comes forward, changes how your spine sits, in the shape of it. So those things can often make that all those changes even worse. So yeah, those are probably the main reasons that women come to me during pregnancy.
Right, but if I go to my OB or even a midwife, I know midwives will ask more questions and will pay more attention, because I've had midwives before. So and they do. You mentioned postpartum. I know midwives see you more often. So midwives might come and visit you at home. Midwives will see you at 2 weeks, at 6 weeks, but they still probably don't know enough to really help. So like if I go to, and I hear it all the time in yoga classes, right? And I try to do my best to help, but I can't diagnose people because A, I'm not a physical therapist, and B, I'm not one-on-one or close to them usually. I can kind of see and recognize based on their complaints, right? So pubis symphysis dysfunction. I mean, I know so many of my students have complained about that. They go to their OB and the OB will say, okay, well, it is what it is. There's nothing to do. Pelvic floor issues, pain, incontinence, lower back pain, hip pain, major hip pain. And so, all right, so what do you do?
So yes, it's very common. I hear very often from patients that they have mentioned it to their OBs, and their doctors say, you know, it's a normal part of pregnancy, and once you have the baby, the pain will go away. But that's not actually true. It's not normal to have pain, and it likely will not go away after pregnancy, which is shocking to many women to find out. But it gives us this sense of hearing from someone that you respect and you trust, which I hopefully you are respecting and trusting your physician or your midwife. But you get this sense of, I should suck it up. This is the way it's going to be. This is normal. Every woman deals with this. And, you know, I just need to deal with it and it will go away, hopefully. But first of all, that's horrible. That's not how our system should be working. But studies showed that when these issues are left untreated during the pregnancy, that it leads to chronic pain. Up to 30% of women that have pain during pregnancy will have it after, and not even just short-term after, but chronic. Decades, years and years later. So, you know, why not treat it now? Why not get the help now, feel better now during your pregnancy and throughout your pregnancy, and prevent this problem from continuing on in the future? So if you do have these issues and your OB, you know, dismisses you, then go out and find a physical therapist, a pelvic health or women's health physical therapist specifically, because we are trained to do this work specifically. But go out on your own and find someone. Google someone, ask a friend, you know, reach out to a community like you. There's people that know who to refer to, and, you know, be your own advocate if you have to. So, you know, reach out to us. We are trained in the techniques, the treatments, the diagnosis to help you feel better. So you are able to go out on your own. And surprisingly, a lot of people don't know that physical therapists have direct access. So you can come to us without having a prescription from your physician. If you don't really want to go that route and, you know, pursue that further with the doctor, you can come to us without a prescription. So don't feel like that's a limiting factor. You don't want to have to ask your doctor, make them feel bad. So, come to us, we can evaluate you, see specifically what's going on, and then create a treatment plan based off of that. A lot of times it's about how our brains are communicating with the muscles in our body and with our joints in our body, and we just need to re-educate and teach our brain to have that good communication with our muscles, so that our muscles can respond quickly and accurately to what's going on in our body and the movements that we're doing, so that way we can better stabilize and perform better, smoother movements, so that we don't have that kind of pain. Right. So we focus a lot on core strengthening, back strengthening, educating, again, those muscles, how to respond, to heavy loads. So women often who have little kids and they're pregnant, you know, lifting that baby up or lifting your toddler up and not hurting yourself, or that extra weight, you know, can often make those movements even harder. So just kind of re-educating the muscles and progressing you that way so that you can perform your normal functional activities without being in constant pain.
Right. Yeah, and I can totally relate. And I know I actually have been to a physical therapist after giving birth because, well, I learned about it, you know, during my training. So I was very curious and I went, and it was interesting the way she checked. I guess sometimes you also check internally, right?
Mm-hmm.
Because you want to kind of assess all the deep layers and all, you know,
Right.
of the muscles. So that was interesting to me, and I got some exercises to perform, and I thought that was pretty cool. Apparently I didn't need further appointments after I had a couple, and I worked on my own. But so there's a couple of things I also wanted to ask you. One of them is incontinence. So that's another thing that women sometimes share, because, you know, we have these circles at the beginning or at the end of class, sometimes during pregnancy, but even more postpartum, that they sneeze or they cough and a little pee comes out.
Right.
Okay, is that normal?
It is not normal. However, it is common. We do see it more often postpartum, but we do see that up to 50% of women during their pregnancy start to exhibit the symptoms of incontinence. And that can be just, you know, noticing a little leaking, and sometimes you don't even know, but like examining what's going on down there, you know, are you noticing any wetness? Are you noticing when you sneeze or cough or lift that you feel like you're leaking a little bit? That is not normal. That's our pelvic floor telling us that like it can't hold on any longer. So, so like I said, it is not normal. There are a lot of strategies that we can do during pregnancy on breath work, trying to engage the pelvic floor and your transverse abdominis, those muscles, to help stabilize the pelvic floor a little bit better. And it's a good time, if you are noticing any of these symptoms during your pregnancy, to get them treated out. Like we said before, letting it go and thinking it will get better, it most likely won't, and it most likely will lead to a chronic issue. So they do generally say 3 to 4 weeks postpartum is normal to have incontinence, because especially if you had a vaginal birth, the tissue is stretched out and it takes a little bit of time to heal. So give yourself a month, and if you're still noticing it, definitely seek out that help, because letting it go will most likely only exacerbate the problem or lead to chronic issues. So anything beyond that month time frame definitely is not normal. And if you're having it during the pregnancy, I would seek out help again now.
Okay. Is it more common? I mean, totally just came to my head. Is it more common for first pregnancy, or more in like the second, third, twins? Heavier it is, the more issues there are, or the more repeat pregnancies, or?
Yes, we do see more with, like you said, multiples, because just the weight, because you think your pelvic floor is a set of muscles that sits on the bottom of our pelvis. The more weight you have, the more, you know, those tissues are going to be stretched. And again, with multiple or with subsequent births, I should say, those tissues have been through even more. But the thing is, they should be able to heal between each birth. Now, to get onto a whole other subject, which I won't go into, but some women have prolapse, and prolapse of those are pelvic organs dropping down into the vaginal cavity. Sometimes if the bladder is involved, we will see a little bit more of that. And that's more common with multiples and with multiple births as well.
Right. Okay, I was just curious, because I know the weight is just a big issue, right? And that's why I really feel like everybody should be going to a physical therapist at least once. I mean, just to kind of see that what's happening. I mean, I don't think people think about it, but so one more question that I have for you, because I know it's very common, and I think it's more common to notice postpartum, but it's happening during pregnancy, is the separation of your abdominal. So the the separation of the first layer, right? Because we have so many layers of our abdomen, right? So
Right.
what is it called, and what exactly is going on, and should you do crunches? Because I tell people, I tell people all the time, don't do crunches. So maybe you can back me up on it.
Yes. Okay, so you're referring to diastasis recti, which
Yeah.
is as the belly grows, your rectus abdominis, which are the two like six-pack muscles, those will start to separate as the linea alba, which is the connective tissue, starts to pull apart, because we need to make room for our expanding belly, right? So those are the most superficial or outermost layers. So again, the six-pack is what, when you think of abdominals, that's what you're thinking. But we have
Right.
many, many layers in there that all need to be strong and function and communicate well with our brain. So basically during the pregnancy, as it separates, which is completely normal, they say after, if you carry past 32 weeks, they say upwards of 100% of women have a diastasis recti, because the belly has to grow for baby to grow, correct? So a lot of people worry about it during pregnancy. If you know about it, some people start to worry about it. And I say it's normal to happen because it has to, okay? The problem is if it persists postpartum, and you can talk about, there's a lot of talk about if it's 2 fingers wide, then it's a bigger issue. Or the tension of it, if you feel it and it feels very soft versus if it feels a little bit firmer. But generally speaking, the diastasis recti, again, is normal, and you can assess it yourself, or you can see a special, a physical therapist that can actually examine it for you a little bit closer. Because the thing is, if it's not very wide and the tension is a little bit firmer, those are positive signs. That's what we hope for if you are diagnosed with the diastasis. But also, are you able to engage your other abdominal muscles enough that when they contract, that they protect your body? So basically, when women try to do, like you're saying, like a sit-up or a crunch, if you look down at their bellies, you'll see what we call a coning or a doming, and you'll actually see like the belly popping up. Almost like pointy. And that's what we're concerned of, because if you continue to do movements and exercises and crunches and lifting and all those activities that increase the intra-abdominal pressure, and you do those over and over again, you're making that tissue even weaker. So if you're able to learn how to contract our deeper core muscles to stabilize that, and you can do a crunch, down the line, I'm okay with you doing crunches. But down the line, you need to have that neuromuscular re-education. You need to learn how to contract the appropriate muscles to prevent that coning or doming from occurring. But generally, people who see a physical therapist postpartum with the diagnosis of a diastasis recti, with a good treatment plan, that separation can get smaller, and that tissue integrity can get firmer, and that's what we're hoping for. So it can heal. Okay, if you do have some residual space or thinness, if you're able to contract the abdominals appropriately and while you're doing those movements, then that's like the next best thing. So those are the 2 things we're kind of hoping for and looking for. So yes,
that's what I Yeah, I talk a lot in postpartum classes about the transverse abdominis, because I tell them it's like creating this corset, right? It's like you want to hug in, and you want to make sure that the deepest layers are stronger, because really that's what brings the abdominals, the rectus abdominis, closer together, correct? Yes. So then you're saying once these layers, the deeper layers are stronger, and you're not doming. So I also talk about that little dome triangular thing that you can see. And I even saw a woman that was so separated that she looked pregnant after having babies. So, and she had to have surgery. Right. It was very, very severe. So you're saying that if you're not doming and your deeper layers are strong, then eventually you can do crunches. But if there's any weakness, crunches are not advised. So really, until you know, that's another reason to visit a therapist, right? To just at least make sure that everything is healthy, you can go back to your normal activities.
Yes, and it's a slow progression. I mean, I don't care what kind of shape you're in or you were in before, nobody's ready to be doing crunches 6 weeks postpartum. It has to be a slow, progressive climb, right? You can't learn to do a marathon when you've never walked before. So you have to that slow, our tissue needs that repetitive, appropriate pull to create the appropriate tension on that tissue. So you can't go from, not doing that stuff all of a sudden be doing that high level activity, because that's the stuff that actually creates a lot more harm than good. So getting it assessed, making sure you're not having that coning while you're doing those exercises is definitely important, because you don't want to end up, creating back pain or other issues from it.
Okay. So to summarize it, because I think this was really good information, if there's any pain, right, or if there's any doubt, or if you really just want to know if you're healthy, if your layers of muscles, deeper muscles, pelvic floor muscles, and core muscles, right, are healthy, and you want to go back to an activity, you would recommend seeing a pelvic floor specialist? Or is it a physical therapist that doesn't specialize? Is it good enough, or does it need to be specializing in that for postpartum or prenatal?
A specialized physical therapist in the pelvic floor, or at least in pregnancy and postpartum, is definitely essential. I had done general outpatient orthopedics for years, and I feel like I was a very skilled therapist, and not until I really dove into this stuff. Now I know that I didn't know, but at that moment I didn't know. So yes, you need somebody that knows what to look for, knows the proper healing, and all therapists know to some extent, but if you need the internal examination, that's stuff that only a specialized women's health therapist would be able to do. And again, like we were touching on before, I really feel like it's very important. It should be part of our medical health system that everyone at least gets one evaluation to see, are you okay? Do you need therapy or not? Are you okay? You can do the things on your own. So any doubt, definitely reach out. And we're here for you.
Yeah, that's awesome. I'm glad that we got to do this, because I know about it, again, because in my studies, I met many women, plus, I did several trainings, and thank God my teachers mentioned it. One of my first trainings, she already mentioned the transverse muscles, the postpartum, how the core is made of. I didn't even know that the core, I always thought that the core was just like you say, the rectus abdominis. But to learn that the core goes from your pelvic floor to your diaphragm and all around, and like how breath can impact your core health and all that stuff. I'm so glad I had good teachers. And then I started giving it to my students. And then I really want people to understand how important it is. So I'm super thankful. And we'll share your information, obviously, and people can reach out and at least get an evaluation, like we said. Maybe they don't need anything. Maybe they're super strong, super healthy, super flexible, super supple, and all that good stuff. But at least it's good for us to know, and especially if women have any kind of pain, right? So like back pain, pelvic floor pain, incontinence, pain during sex, right? And all that stuff is someone who specializes in physical therapy in women's health, right?
Yes.
Okay. Perfect. Awesome.
Great.
Yay. Okay, Lauren, thank you so much for making the time for us. And we will definitely share information. And I hope to actually meet you again, and we'll share some more valuable information for all these awesome pregnant people and postpartum people around. So thank you so much. Bye. Have a good evening.
You too.
Send love to the family and the kids.
Thank you. Bye.
Bye.